Well, welcome everybody. It's 7 o'clock, it's Monday, and it's time for the Royal College of Surgeons of Edinburgh's weekly webinar. And as many of these webinars have been over the last 7 months, this is devoted to trainees. My name's Michael Griffin, I'm president of the college, and I'm absolutely delighted to have with us basically the two chairs of JCIE and ICBSE. The chair of JCIE, John McGregor. Thank you for coming, John. John Hines, chair of ICBSE, who's masterminded the MRCS. We have the head of operations of JCIE, Martin Owen, who runs the show. And so, Martin, thanks for coming. And I'm delighted to have Greg Ekatah, our college leadership fellow, colorectal surgeon, who interestingly is taking the section 1 of JCIE. Good luck, Greg. And we have Lola Giwa, who's a plastic surgeon from the Royal Free, who's the vice president of ASIT. Lola, you're very welcome. This is your debut with the Edinburgh College. Great to have you here. So we've got a great team, and I want to encourage all of you out there to ask questions. Use the Q&A button and the chat box. We want to hear from you. I believe that we've done the right thing in concentrating these webinars on our trainees. Our trainees are the future of surgery. I've said this many times, and I believe that you have been the most disadvantaged of all the medical professionals, particularly the surgical trainees during this pandemic. You've been redeployed, your training has been paused, and of course assessments have been halted during the last 7 months. And so it's been a very worrying and anxious time for you. And we've tried to keep you up to speed with what's been going on. And that is what this is all about today. I'm going to let John Hines talk us through what has happened with the MRCS. And I'm pleased to say that's a really good news story. And then we're going to go on to John McGregor, who is going to talk about the plans for JCIE upcoming in November and December. But I want all those questions to come in. It's a worrying time. You all will have those questions. There'll be lots of minor details that you might want clarification on. We've got two outstandingly eloquent trainees on the panel who will look at it from your perspective as well and be able to help you with those answers. So I think I shall just invite John Hines, who is a much more relaxed looking John Hines to the one I saw about 10 days ago before the MRCS. So John, would you like to just tell us what has happened over the last week or so with the administration of the MRCS exam?
Yes, Mike, thank you very much. In fact, it was 2 weeks that we held the MRCS examination, and with a lot of preparation from the early part of the summer with weekly meetings of the delivery group, we fairly quickly worked out that we were going to be able to have face-to-face examinations rather than remote delivery. And we delivered the diet on the published dates, which was obviously better in terms of preparation. Lots of people couldn't take the membership exam in May, but we were able to accommodate everyone who applied to take the membership examination that is just about finished. So we had more than 600 candidates at 6 venues taking a face-to-face MRCS examination. There were 2 small concessions. We took out 4 of the stations in the OSCE, so we only had 13 questions, and that was to facilitate safe face-to-face delivery with lots of social distancing and just slowing things down a bit. And we didn't have any direct patient contact, although there were patients there involved in giving a history. And we were very pleased, actually. We've had very good feedback from candidates, had very, very good feedback from examiners and college staff, and the assessors were there as usual, and the assessors were happy as well. The colleges, all 4 colleges, have fed back to me today. We had a total of only 29 candidates not turn up, out of well over 600. So that's a smaller number than we would expect. There are always dropouts. And out of those 29, only 8 were probably COVID related, people who were being forced to self-isolate. One thought they might have symptoms. We had a very strict questionnaire that candidates were asked to fill in and submit 3 days before the exam, and everyone complied with that. So if we've only had 8 people out of well over 600 be disadvantaged because of the pandemic, I think that's very good. And due to a fantastic effort actually by the college teams and the examiners, we were able to hold the examination, and we really do think now that we have caught up with all the UK and Ireland candidates. So we're quite pleased. We do have the facility, if we need, to run a small remotely delivered catch-up examination in a few weeks' time if we need to help out the 8 people who couldn't take part because of the coronavirus. But we're just very pleased that it went so smoothly and so well. And despite the small concessions, it was a real exam. The GMC, when we submitted our plans to make these small changes, were very happy that this is a real MRCS examination and ratified it as a real examination. So those that passed can be proud of the fact they've got a real MRCS. It hasn't been dumbed down. And we're making plans now to carry on with another exam in February, as we should be doing. You might be muted.
I am. Back on now. John, that was great and a good news story. And I guess we shouldn't be too relaxed at this stage, because it's about 10 days since then. We would be, if there was to be anything related to an infection risk or a little mini outbreak related to the MRCS, it would probably be showing now. So I think we can start to become pretty relaxed that this has been not just a success for the candidates, but a success for infection prevention as well. Would you say that?
I think so, yes. I mean, the way that all the candidates in particular complied with the rules and regulations we put down about social distancing and wearing masks was fantastic. We slowed the exam down a bit, and everyone really, you could see, was trying very, very hard to make the exam work. Because obviously the candidates want to take the exam, they need to progress. We had a sort of a 2-layered contact tracing system, one run by the venues and the other one run by the colleges. And all candidates have been asked to contact the colleges straight away if there are any subsequent problems with their health that might be related to the pandemic. So if anything happens, we'll know within the next few days. But so far, we've heard nothing.
Yeah, and we've heard nothing as well. And we'll come on to JCIE and what John and Martin have put into place in due course. There's a lot of questions already piling in about the international MRCS. John, I see you smile. I know what you're going to say here, but there are a lot of questions and we need to address that. Nidhi Kapadia from India is saying, when is it going to be conducted for international candidates, particularly in reference to the February diet? Do you want to comment, John?
Yes, so I'd say at the moment we don't know. We haven't been able to finalise any plans for taking the examination abroad, and we're still working on the possibility of having a remotely delivered examination as well, which obviously increases our options. We have only just finished the MRCS in the UK and Ireland today. So our next delivery meeting to take the plans forward is on Wednesday. And you can be assured that on Wednesday, we're going to start talking about next year, both home and abroad.
I mean, we have got to be very cognizant of the infection rates around the world and in particular in India, which is where a lot of the questions were coming from. What I think we have to reassure all of our our trainees in India that are desperate to take these exams to progress their careers, is that we are going to deliver this somehow. And there's a huge amount of work done by ICBSE on trying to provide a secure and stable environment to do this remotely, which would help us to be able to run the exam, particularly in India. It may be that next year, early part of next year, there are some countries that it will be possible to do face-to-face exams. And of course, that would be the preference, but it has to be safety first. But we haven't forgotten about the international exam. It will happen. Whether it be remote or face-to-face depends on infection rates and the state of the pandemic in 2021. And we will do everything we can to inform you. But at this stage, we can't answer any more sort of a time frame, if you like. Is that fair to say, John? Are you happy with that?
Mike, yes, that's exactly how it is. But we're all very confident that we will be able to conduct a remotely delivered examination before the end of 2020, and then it's just adapting it for the venue and other dates. So we do think we'll have a viable solution in the first part of next year. But you're right, in terms of a face-to-face exam, it depends on the prevailing conditions at the time.
And 600 candidates, you said, that's in the UK and Ireland.
That's right, yeah.
And 29 didn't attend, so
that's right.
Just under 600 that will have taken this exam. There can't be too many that are waiting around to take it in a few weeks' time, surely. Is it not worth just waiting till February?
Well, we think there are only 8 candidates who have been disadvantaged, and that information has only come out today. Right. So in last week's delivery meeting, we said we'd wait till this Wednesday to decide what to do. But we're certainly going to have a pilot examination with trainees who aren't taking the membership before the end of the year, just to show we can do it. So it's full steam ahead on both fronts, actually.
Great. Okay, John, that's great. Okay, Greg or Lola, any questions for John at this stage, or should we move on to JCIE?
I've just got one comment, really, for John Hines. So someone who sat the Part B MRCS suggests that the 30-minute explanation that they got on the day was extremely useful, and should consideration be given to have that information sent out to them a little bit earlier before the day, because it helped ease anxiety and would have helped prior to the day. So is that something we should consider for the future?
What we actually did is there was a webinar a week before the examination, and I presented that presentation which I wrote at the webinar, and it was sent to all candidates before the examination. So possibly they missed it. But you're quite right, there was loads of information. And the preparation for the MRCS started 3 days before, in terms of who's got symptoms and filling in the safety questionnaire. And everyone really complied. It was amazing.
So they must have missed it, Greg. Suitably chastised by the chair of ICBSE. Beautifully
feed that back.
Lola, anything in the chat that you've noticed that you'd like to ask John?
It's mainly on. It looks like it's mainly on FRCS, I think.
Yeah. Great. Okay.
Mike, if I may, John, there's just a few questions around when the Part B results will be out. That seems to be coming up quite a lot. So can we just put their minds at ease just now?
We usually it's about 6 weeks, and we're not certain exactly because we wanted to see how we got on with the examination. But because we held a full examination with very few dropouts, the analysis of the results will carry on the same. So I think it will be about 6 weeks. I'm afraid I can't confirm that, but on Wednesday we will know.
Good. And John, to blow your trumpet a little bit, you certainly did webinars, both with the English College and with us, in fact, two with us, to explain exactly what was going on in terms of the change to the exam format, which was, of course, approved by the GMC. Just briefly summarize that change from the number of stations, just so that any prospective candidates for February understand that.
So the MRCS had 17 questions, and we took 4 questions out to give the examination more time to run. So we spaced out the questions so there was less difficulty with candidates moving around the circuit. And the questions involving procedural skills, for example, where there was suturing, to a pretend wound on a patient's leg. The patient just wasn't there, but the question was exactly the same apart from that. So it was a slight adaptation to the questions. And then we looked at the spread of the questions, and then and had to write in detail to the GMC to guarantee that we were asking a full range of questions covering the entire syllabus. And of course, there are many different exam circuits over a 2-week period. So we're completely certain we covered the ground, and the GMC were completely certain. They also wanted to know about the methods we were going to use to analyse the results, which was given to them in detail, and they were very happy with that. And in simple terms, which I certainly needed, the exam reliability was probably just slightly better than previous recent diets of the membership exam. And when we will know that very soon, and we have our IQA meeting, the quality assurance meeting, to ratify the results coming up in a couple of weeks. So it's a real exam, and I think the candidates at the end all acknowledge that, actually.
Great. Thanks, John. Right, John McGregor, let's go over to you. And I think you've got a presentation, and you're going to share the screen to talk about preparations for the FRCS. John.
Yeah, Mike, it should have come up on screen.
Beautiful. See
it. Right. Okay, well, thank you again for inviting me back. I think I should start just by echoing everyone's congratulations to John Hines and the exam teams of all 4 colleges. I don't think you've actually mentioned it, Mike, but John is very recently into post and came into the chair at a difficult time. And it's also slightly more complicated for him in that he's overseeing 4 colleges running the MRCS Part B on a collegiate basis. So a fantastic effort. John, you really should have a big armchair sitting there tonight and laid back and enjoying yourself. So well done. I hope we can emulate that. So what I'm going to do is just take you through a little bit of an overview of where we are at JCIE. We are one organisation. We administer all aspects of the FRCS exams on behalf of the 4 colleges. So I am an intercollegiate chair, as is John is, but Martin and I deal with all aspects, including delivery of the exam on behalf of 4 colleges. So I'm going to talk a little bit about where we are with Section 1, how we've got to where we are with Section 2 throughout the multiple changes of 2020, outline what the format is for the exams between November and December, cover the venues, our COVID-related safety measures, what we have planned for remote assessment, and temporary changes to Section 2 attempts, and a little bit more about travel and accommodation. And again, Martin and I will be happy to answer questions afterwards. Section 1, everyone's aware that since 2011, JCIE has delivered the MCQ exams in partnership with Pearson VUE. That remains the same, and that is the method of delivery that will be taking place next month and in January. The date, the exams are listed there. This is not a revised timetable. This is the timetable that would be taking place at this time of year anyway, with 5 specialties having a Section 1 diet in November and the other 5 in January. But Pearson VUE, we've been in regular liaison with over the last 6 months or so, and they've done a fantastic job of adapting their setup to allow them to accommodate all candidates that were postponed from June, July 2020 when we had to cancel exams. And in addition to that, have been able to accept all new applicants who have become eligible to enter. So in next month alone, in November, there was something of the order of 600 candidates sitting, and in total there were 498 displaced from earlier in the year. Again, we're in regular dialogue with Pearson VUE. They have no plans to change anything at the present time, so the system is live. It's worthwhile just for candidates that are listening and here tonight just to keep in touch with the Pearson VUE website as well as the JCIE website. And Pearson VUE, they may have told you already directly, but if they haven't, please note that you must take your own face mask to a Pearson VUE centre to sit section 1. They will not allow you in without it. And you will see on their website all the other COVID safe measures that they have brought in as well to allow you to accommodate with social distancing. So please take note of that. If anyone has applied and is expecting to be sitting an exam in November and they haven't heard anything yet, please just make contact with the specialty managers to chase things up, just in case things have gone astray. But I would hope that everyone will have heard about the November exams that was expecting to sit now. Section 2, a little bit more complicated though, because historically we've been dependent on travelling around the UK and Ireland to stage Section 2 in clinical facilities, with the exception of the urology exam. The urology exam in its 30 years of existence has always been an orals only exam. So to take you through the timeline, on the top here, everyone is well aware that the 13th of March, the Joint Surgical Colleges released a statement that all face-to-face examination and educational activity was being suspended from 3 days later, Monday the 16th of March, until the end of the summer at the latest. It was deliberately left open-ended because clearly we had no predictive information as how the pandemic was going to go, and sadly that largely remains the case. That cancellation, or that regulation that came in then, led to the rapid cancellation of exams, and indeed there were neurosurgical Section 2 candidates just about to sit an exam a week or so later that had their exam cancelled. So we took a decision with the college presidents and the chief executives in April that we would not restart face-to-face examining activity until November. So that was in April at the Joint Surgical Colleges meeting, where the presidents, vice presidents, chief execs and intercollegiate chairs come together. The first bit of our sort of recovery planning was through May and June, and the plan at that stage was to try and run the traditional examination with lots of volunteer patients and physical examination, recognising, however, that we were not going to get into mainstream clinical facilities. The idea was to use Scotland's equivalent of the Nightingale Hospital. I was heavily involved in the setting up of that, indeed remained part of the medical team there. So, and I got permission from the Scottish Government to use that, and it would have been perfect as a socially distanced large venue. However, my sleepless night increased, and really, as Martin and I we sat one day in the Louisa Jordan and said, can we realistically expect patients to come and be examined? And you know, if I worked it out, the trauma and orthopaedic exam is our biggest exam. There was going to be at least 1,300 candidate patient close encounters if we ran the traditional exam. And we really decided at that stage, for a start, we would struggle to get the patients, but even if we did, was it morally appropriate to expect them to be examined? So we decided at that time to cut the patient numbers down by taking patients out of short cases and retaining them in long and intermediate cases for communication purposes. That, of course, does require GMC approval. So any change to any assessment or curricula does require GMC approval, and the GMC supported us in that. So that allowed us to move to the hotel-only venue. But of course, some things have crept along. The pandemic has continued, and so at the beginning of October, I really felt we had to extend this now. We were not going to get patients rapidly volunteering to come forward, even for communication, even if they weren't going to be touched. And the worst case scenario was to have an exam set up and the patients did not appear on the day. That would have been a disaster. So we went back to the GMC to extend that change to the longer intermediate cases that the GMC supported. So there are no patients of any sort in any of the Section 2 exams now planned to take place in November or December. We don't, of course, do this ourselves. We have been in consultation with all major stakeholders since the spring. I've had more meetings with the GMC in the last 6 months than I've had in my career, I'm glad to say. But I'm glad to say in the sense that is a good sign for me. But I have to say the GMC have been superbly helpful. And I think one good thing that's come out of all of this is that a lot of us are talking to each other a lot more than we did previously and understand each other much better. But in addition, all the colleges have been involved, the Red Arrow here, the Joint Committee on Surgical Training, the Academy of Medical Royal Colleges, the Confederation of Postgraduate Schools of Surgery, and the educational providers, HEE, Health Education England, and NHS Education for Scotland, etc. But I just want to pay tribute to the input we've had from trainees. Martin and I have met separately with the presidents of ASIT and BOTA on a number of occasions. We've had the trainee reps involved in all our major decision-making meetings, and I've been very grateful for the support of the trainees throughout this and their understanding of who they are. And finally, at the bottom, in order to stage these exams safely and for reputational reasons too, I have been working very, very closely with the Scottish Government and the National Clinical Director's Office, hence the exams are being staged in Scotland, and was in contact with them as recently as this morning over the telephone, and they are happy with the plans that we have in place. And even despite everything that you're reading in newspapers and seeing on television today, the Scottish Government are content with the way that we are working. So when you come to a Section 2 exam in November or perhaps in early December, when it comes to the oral sections, and I say the modifications here will apply to the 8 specialties that are taking place, but not urology, because urology has only ever had orals. So the orals in all exams will be absolutely no change to the number or the structure of the orals. Paired examiners, as usual, with designated question topics coming from our mature question banks. There will, however, only be 2 examiners and a candidate at the table. There are, under normal circumstances, exam assessors will assess each examiner face-to-face twice in a diet. We'll also have examiners on training, and sometimes we'll have external observers. We have removed all of that from the presence at the exam tables to reduce the size of the gathering and not bring another household into the equation. That's not to mean exam assessment and examiner assessment is not taking place, and I'll come back to that. So for the clinical stations, as I said, there are now no patients at all, but they will be structured clinical scenarios, largely based on real life and indeed some based on previous exam episodes. The intercollegiate specialty boards, under the direction of a chair from each specialty, have been working incredibly hard over the last 2 to 3 weeks producing these. So it's not going to be a case of somebody turns up in the day and just decides what they're going to be asked. This is structured. And indeed, you could argue it perhaps will be more structured than the normal clinical exam, where the examiners don't know what patients they're going to be seeing until they're in the exam venue an hour or so before the first candidate appears. We will mimic some communication, and the paired examiners, there's only one examiner questioning at any time. The non-questioning examiner would normally be confined to recording responses, but we are encouraging the examiners to role play for communication purposes. So then the examiner that's talking to you may say, here's your patient, will you take them through the consent process for a hip replacement or a cholecystectomy or whatever? So that communication element will still be there. And there'll be clinical photographs, radiology, test results, props if necessary, but no physical examination. And I come back to what I said a moment or two ago about the preparation of clinical scenarios. Again, in any of these exams, examiners don't just turn up and go straight into an exam room. They meet the day before, there's calibration of all the questions, there's an examiner briefing and update sessions. We are extending that for this exam because we recognise it's a change in format for the examiners too. They are all experienced examiners and they will be brought together for a considerable period of time the day before to go through the methodology that's being employed. So when it comes to marking, there is no change. It's the same number of examiners. The questions will be calibrated as before. And I say, in a sense, the clinical will probably be, the clinical in inverted commas will potentially be even better calibrated than usual. Mark sheets will be the same, the number of marking episodes is the same, the descriptors the same, and the calculation of the pass mark the same. Now, I did mention there will not be assessors, exam assessors at the exam tables, but there will be an assessor there who's assessing process, and examiners will still get their quantitative examiner feedback. We collect a whole series of statistics on how examiners perform and mark relevant in relation to each other, their co-examiner and the cohort as a whole. So for you as candidates, whilst recognising there's a change in format to the clinical, your preparation should just be as you would normally do. It remains mapped to ISCP curricula, so it's essentially just a modification to delivery, but the same assessment. So overall, the standard is unchanged. It's set at the level of a consultant to consultant level discussion. It's pre-calibrated, emphasis on higher order thinking, not just simple knowledge recall. It's application of knowledge, decision-making, interpretation and judgment, with the standard set of a day one consultant in the generality of the specialty. So that is unchanged from usual. The two venues, we have concentrated these in Scotland. Now, the majority of the exams are taking place in the Crown Plaza Hotel in Glasgow. The very simple reason for that is it is immediately adjacent to the Scottish Exhibition and Conference Centre, which is where the NHS Louisa Jordan is. So at the time that we were planning to use the Louisa Jordan, the hotel directly links into it. That was the partnership. But as it transpires, the hotel has got perhaps the biggest ballroom I've ever seen, certainly the biggest one I've ever used for the exam. So it's perfect for social distancing, plenty of space, and the staff there, as I'm sure Martin will confirm, have been extremely helpful. We are holding the urology and paediatric exams in Edinburgh and the Royal College of Surgeons of Edinburgh in the Quincentennial Hall, but the rest in Glasgow. But we've had to introduce some changes otherwise because of this pest that's been on our doorstep for this year. I think any of you sitting section 2 will either have received or will be very soon to receive your examiner packs. Patient safety, or everybody's safety, candidates, examiners, staff, and patients, if we had them. Safety is paramount here, and we will be sending all of you out, if you've not got it already, a declaration that you'll be asked to consider. And the format will be that you will sign a candidate registration to say that you have read and complied with this. Now, basically, as you'll see there, is that you've not had COVID-related symptoms in the last 14 days. You've not been living with anybody that's been asked to self-isolate. But if the answer to that, either of these two questions is yes, and you've had a COVID test subsequently, that will still permit you to enter the exam. Now, crucially, you will see that it does not say that you've not been in a contact with a COVID patient in a working environment, because as medical practitioners, we are assuming that in doing so that you've complied with all your work-related safety measures, including relevant PPE there. And you will find a very, very similar statement on the Pearson VUE website for section 1. And you're going to have to sign to say you can comply with all the other general and generic guidance that's there for the general population. And that the bottom one is important, that you must report any new symptoms that develop during the examination. It would be a probity issue not to do so if you take unwell between day 1 and day 2. At the exam venue, we are going to do daily non-contact temperature checks. This is not just for candidates, this is for everyone. Staff, the secretariat, myself when I'm there, and all the examiners and assessors. We have purchased non-contact thermometers. 37.8 would be the temperature that's recognised as a fever. But what I would say is we will not take a single measurement at 30.7.8 as a reason for not allowing you in. If it happened to be around that level, slightly above, we will ask you to just sit down and take your time for 10, 20 minutes or so while we go through 1 or 2 processes and then recheck it. We have sent out the information to you that everyone is required to wear a fluid resistant or type 2R mask. We will supply these. I know there's been a question already, and I have been asked it before, can we bring our own masks? The answer to that is yes, you can. You can bring a mask that you're comfortable wearing, but we would ask, as approved by the Scottish Government, that it's a type 2R fluid resistant mask. Social distancing, Martin and the team in the hotel have worked a lot with, and we've got signage for one-way foot traffic, sanitisation stations, catering is spread out, there's a lot of space there. You will be aware that imaging in the Section 2 exams is done on iPads, and often the iPad will be handed to the candidate to ask them to orientate it. We would ask that you do not do that. You can instruct the examiners to control the iPad, but as a candidate, you don't touch it. It's just, again, as you would expect, the contamination, and we'll have hand sanitisation anyway, and clearly handshakes and other courtesies will not occur. We get asked about remote assessment. We put out criteria about remote assessment. It's on our website, and what we stated some time ago now, and I think I released information to all of you, I can't remember whether it was August or September, that we would undertake to provide a remote assessment if there was a government enforced travel ban and/or quarantine requirements. Now, the important word there is ban, not an advisory, and I'm going to return to that in a moment. Currently, the only area that this applies to is the Republic of Ireland, because anyone going to the Republic of Ireland from the UK has to quarantine or self-isolate for 14 days on return. We also said, and I took advice from the President of the Royal College of Obstetrics and Gynecology on this, that women in the third trimester of pregnancy should not come to a face-to-face exam, and we would do these remotely. And we extended the ability to the facility to anyone who on medical instruction was isolating from work or social contact. The delivery, however, of a remote exam is not from home. This has been done in designated centres. The Republic of Ireland candidates will all be in the Royal College of Surgeons in Ireland, in Dublin, where they will be invigilated by Irish-based JCIE examiners who, for the very same reasons as the candidates, can't travel over because they have to quarantine on their return. And the whole process is incorporated into the exam schedule, so there's no difference in the scheduling, just we use separate rooms, obviously. And we did say that we could only do this when measures were in place 21 days prior to start of the exam. It's just impossible for us to adapt any shorter notice than that in terms of organising centres, organising invigilators, organising the schedule and whatever. So I think these measures are in place for Ireland and the small number that fall into the category under the criteria there. When we come to talk about examination temps, I think you all know that at both sections of JCIE exams, there is a 4-attempt limit with no examination re-entry. This is in line with GMC guidelines, but we have agreed with the GMC that given the short notice of the change in examination format, that anyone who is unsuccessful in the exams in November and early December, that attempt will not count towards the normal maximum permitted number of attempts for this first running. And that's to allow, because of the short notice, and to allow us to go back to the GMC and demonstrate our psychometric data that we collect. So in terms of travel, this applies to both Section 1 and Section 2. Please adhere to all COVID-related measures. And the one thing I would say, if you've got symptoms, please do not travel. You mustn't travel if you're unwell with COVID-related symptoms, whether it be to a Pearson View Centre or to Glasgow or to Edinburgh. If you're on public transport, adhere to the measures that the government advises. Please avoid car sharing. You know that that's a recommendation across the board at the moment. And accommodation, not to stay with family or friends. It needs to be in a hotel and it's single room occupancy unless you're traveling with someone that you live with. But the important thing, and this is where I come back to that word ban earlier, the travel and related accommodation is still permitted for work and education to and from the Tier 3 and the localised lockdown areas of the UK. And that includes Northern Ireland, Tier 3 areas such as Merseyside, and the latest announcement today from Wales. And I have discussed this directly with the Scottish Government today, who are in contact with counterparts throughout the UK. So that is where we are at present. We have sent out some supporting documentation. Anyone who is registered to be sitting an exam very soon, irrespective of Section 2.1 went out at the end of last week, the Section 1.1 today, that Professor Griffin, as chair of the Joint Surgical Colleges, and myself as chair of JCIE, just in case anyone stops you, that you have got confirmatory documentation. And indeed, the Academy of Medical Royal Colleges issued a very similar supportive statement on behalf of all Royal Colleges about 2 weeks ago. So if anyone hasn't got that, please let us know, but it's also on the JCIE website and you can download it from there. What happens, however, if you're at the exam, particularly the Section 2 exam, and if you develop symptoms? Well, the bottom line is you've got to report it, and you all know the major symptoms to look out. The key ones being fever, new persistent cough, new shortness of breath, loss of taste or smell. I've said already that borderline temperatures will be granted a repeat assessment rather than one strike and you're out, so to speak. Hopefully, I was encouraging to hear what John Hines said about the MRCS experience. If anyone has to be excluded on medical grounds, it will be medical grounds, and the attempt at the exam will be nullified, irrespective of how far into it you are, and the examination fee transfer. But clearly, if there's any risk of someone having COVID, we cannot have them in a gathering, which is otherwise not allowed anywhere in the UK at the moment, or in Ireland. So let's hope. We have a saying in Scotland, lucky white heather. There's some white heather for you. I'm hoping that everything goes as well as it did for MRCS. I think, it's been a lot of work and a lot of partnership working, and I'm very grateful to the team for that over the last 6 months, and to everyone, including BOTA and ASIT. If we get kiboshed at the last minute, it will not be for the want of trying, but I'm relying on my white heather. And I'll just conclude by saying this is only January of last year that I took over the chair of JCIE from Mike Griffin when he was elected president of the Royal College of Surgeons of Edinburgh. I had much less grey hair then than I have now. And I think I now know the feeling that he does when his rival football team in the northeast of England scores against him. So, Mike, thank you for that. I think you got out at the right time. And finally, I'll just leave you with a photograph of Glasgow in wintertime overlooking the Crown Plaza Hotel across the River Clyde, where many of you will be next month, and happy to answer any questions. Thank you.
Thank you very much, John. That last slide, which I found deeply offensive, seeing the black and white stripes of Newcastle.
I knew you would.
I've had it up to here. Greg up on the top screen had done the same to me in a podcast earlier on this week. So I'm getting used to this abuse. But that was a great presentation, and notwithstanding that last slide, it was absolutely superb. And you've covered everything, and you've covered exams as well. And I think that will have really reassured a lot of the candidates about how much thought has gone into making it safe for them, safe for examiners, and a safe and secure and valid and reliable exam. And that is the most important thing, that the standard is the same. And I think that anybody during this time, please do not think that you are getting a COVID exam. No. That is nonsense. This is to the same standard. You heard it from John Hines as chair of ICBSE. You've heard it from John McGregor as chair of JCIE. So this is exactly the same exam. So there have been huge numbers of questions coming in. And so I suspect that Greg and Lola have got a whole list of them ready to go ahead. Lola, do you want to start?
The first question, I think, is there have been a lot of questions about the ophthalmology exams. Will there be more information about those?
So the ophthalmology exams are very much collegiate exams, and so that is available on the website. Just go to, certainly from the Edinburgh College's point of perspective, you go to the college website. If it's not there now, it will be very soon. Exams start in January and February, and they will be run remotely. So I think that's all we need to say about the ophthalmology exams, Lola.
So I had another one. So just a question from an Irish trainee. Will they be examined by examiners in Glasgow, or will they be examined by local examiners in Ireland?
No, I'll take that one, Mike, if you like. No, they'll be examined from Glasgow remotely via Microsoft Teams. We have tested the connections. We'll be doing some further testing. I should also have said that when it comes to candidate briefing in Ireland, I will be meeting with all the invigilating JCIE examiners by Microsoft Teams one night next week, towards the end of the week, just before we start the exams. So the invigilators, who are all JCIE examiners, will do the briefing for the candidates, but otherwise they're there just to ensure that everything runs smoothly. The questioning will come from the main exam centre, whether it be Glasgow or Edinburgh, via Teams.
Thank you.
That's really important to get. I can understand the confusion there when with John talking about JCIE examiners in Ireland. They're actually not examining. They are there to make sure that there are no problems. They're invigilating, making sure that the candidate is behaving appropriately and so on, but they're being examined by the routine examiners who are examining everybody else in Glasgow, or if you're doing urology in Edinburgh. It's a very important question, and I can understand the lack of clarity. Yeah. Another one, Lola.
Another one. Do you think that any of the changes or adaptations to the MRCS or FRCS will remain in the long term?
That's a good question. John, do you want to take that? John Hines, sorry.
Yep. So we have permission. We had permission to do what we did from the GMC. And if we want to not have the standard MRCS examination, again, we would need further permission to do that. At the moment, we don't plan any long-term change based on what we have done, but we are extremely keen always to keep the examination up to date. And we will look very carefully now at what has happened to see what the examination will become like in the future. The examination is actually scrutinised the whole time and has recently been changed from 18 to 17 questions. And this is going to give us loads of very valuable information on the new format, and of course doing it remotely. But at the moment, there are no plans for permanent change using the format we've just done.
Right. And reliability and validity of the exam, you're an IQA man, quality assurance man, John, going from 17 to 13, no problems?
I am. Well, when we modelled it, there was probably slightly better reliability with 13 questions. And now, of course, having just finished today, we'll be collecting the results in and analysing them very, very carefully. But most people don't, most candidates I'm sure don't know about the IQA committee, and the IQA analyses everything to do with the exam every time. And we'll get some very valuable information about reliability. It won't be very different from what we used to, however.
Thanks, John. Can I bring Martin in? Martin, you've probably been looking at the questions. You may have picked out some that you wish to answer, or that particularly pertain to you as an operational lead, but the challenges that you're facing in delivering the absolutely smooth running of these exams under these sort of restrictions has been very, very difficult, and we don't underestimate how much work that you have put into this. But what do you envisage may be the issues on a day that you might have to deal with?
I think, thanks, Mike. For the first couple of exams, in particular, general surgery and trauma orthopedics, we are going to be dealing with very large groups of people. We are trying to manage that through the days and to break it up into manageable amounts. And what I will say to the candidates is we are normally pretty strict with how we treat both our examiners and our candidates. And it's everybody's best interests at heart. But please understand that we will be even more strict in November and December in terms of directing our candidates around and our examiners too, and just making sure that everybody is doing it as we're asking them to do. So wearing face masks throughout the entire time in the examination venue, We've asked all of our candidates please to bring a water bottle to the examination. There will be water barrels available where you can take your refills, but there won't be the usual bottles and bottles or jugs of water here, there and everywhere. So I think work with us when you're in the exam venues. Our two partners, the Crown Plaza and the Edinburgh College, have been outstanding in helping us to make sure that we're able to social distance throughout the entirety of the exams. You might find in your examination waiting areas that you are asked simply just to sit in your chair and not mingle around. And I'm afraid that's the way it has to be. We will certainly open the doors. You can go out and have a walk outside. That's absolutely fine. But we will be encouraging everybody through signage and through the chair's briefing to really treat it like, more of a candidate sitting area rather than mingling and wandering around. We'll have lots of catering areas spread out, and we'll have signs asking you to only have one person at that area at the one time. So all of these things will be in place, and we really need you to work with us to make that happen.
A plea really to all the candidates, please wear your face mask, because we don't want to have to say you can't take the exam because you're refusing to wear a face mask or anything like that. Please understand what the issues are. You're working in a healthcare environment anyway, day in, day out, so please treat this as almost a patient encounter, even though it isn't. It's very important that we keep very strict health guidelines. Greg, did you have a few questions that you wanted to highlight?
Thanks, Mike. Yeah, I do. I recognise the time, so I'll keep them fairly brief. John Hines first. There's some comments around technical issues with MRCS Part A and potential resits, etc. Any comments on that? Yeah,
thank you. Yeah, so about 4,000 candidates took Part A remotely, and we think about 130 had problems uploading their answers. So before any marking was done, the candidates who have been identified with that problem have been offered the chance to resit the examination, and that means they have to give up their previous attempt. It counts for nothing. If the answers ever turn up, they would not be marked. It doesn't count for a go at the examination, and it doesn't cost anything. So everyone who had a technical difficulty has been offered the chance to redo the examination. Clearly, this is going to hold up their results a bit because the examination has to be put on again. But the timing of that has been such that for candidates who pass, they will get their results easily in time if they wish to apply for the February diet of the MRCS next year. So it won't have a material impact on their progression.
Thank you very much, John. Another one whilst you've got the mic. Will Part B in February be prioritised for core surgical trainees over others?
No, I don't think so. I think we've caught up with core trainees. We don't know how many people, of course, will apply to take the examination. There hasn't been a final decision, but I think anyone who wishes to take the examination should apply. So we accommodated more candidates than usual this time, and having shown we can do it, we would always try to do that again, I think. But we do think we've caught up with core trainees. So everyone who wants to take it should apply, and we'll try really hard to accommodate everyone.
Thank you very much, John. John McGregor, I've got 3 questions for you. The first one, similar in terms of prioritization, there's some discussion about FRCS ortho having a degree of backlog. So therefore, will the next sitting have some form of prioritization?
Well, we haven't gone down that route because we don't need to, Greg. We are accommodating the entire backlog. in the exam in 2 weeks' time. We have not turned anyone away. We did, yes, for general surgery and P&O at the SISM, we brought the closing date forward a wee bit, but on the other hand, there wasn't a section 1 to fill up extra places anyway. That was part of my thinking right from the word go. I did not want to have to turn candidates away because building out an even bigger backlog, you just get a domino effect rolling forward. So I do not, there was a question I saw, and I think I answered it, about the February diets being larger. They shouldn't be. We can run these exams as planned. We have absorbed the backlog.
Good to know, thank you. And second of all, some conversations about 14-day isolation or non-COVID contact prior to the exam. Can we just clear that up?
It was 40, well, the declaration is that you haven't got COVID symptoms and nobody you're living with had COVID symptoms within the last 14 days. But if you have, and you've had a COVID test, that you bring evidence of that to candidate registration, you still will be allowed in. It's just we cannot have, as you will understand, as Martin mentioned, a number of these gatherings, someone who's potentially got COVID coming into a gathering of 200 people. I mean, that's what we are realistic, what we're running with the T&O exam. It's these sort of numbers, not all at one time, but nevertheless over the 3-day period. So the COVID test will mitigate against that.
And final question, contingency planning for February. If the pandemic continues with rising numbers, what are the strategic thinking around a February diet of Section 2?
Well, the temporary COVID-related changes that we have full approval from the GMC for last for the duration of the impact of the pandemic. When I put in the application, we put it through to potentially carry us right through to next May, which covers the next series of sittings between February and May. I think what format the exam will take in February will depend on how things progress over the next few months. It may or may not allow us to bring the patients in for the communication purposes, which is where we were between July and October. Or it may be the same as we're planning to run this time. I think it's highly unlikely that there will be physical examination back in for February. Simply because even the facilities to get into a hospital, you're not going to do that. So we anticipate running in the same venues as we're running in November in February, and we've essentially already made that decision with our board chairs. I know that Martin might want to come in on that one just in a moment.
Only to agree with you, John. That's the GMC approval. We've already done some future planning with potential similar venues. So that's the direction that the plan is going in at the moment.
Mike, I'm sorry I lied. I said it was my final question, but I've got one more. If a lockdown, the likes of what Wales is seeing at the moment, would that affect the Pearson VUE centres for Section 1? If that happened elsewhere?
Again, I was going to come to that because I think I typed on the thing. There's a couple that would arise, answer live. And again, I'm going to hand to Martin in a moment, but there were questions about Northern Ireland and about Wales. What I would say, I would reiterate at the moment that it's not a ban on travel. It's advice against travel if it's not essential. And travel for education and work is considered essential, and you will still be allowed to travel at the present time. So that's Section 2. When it comes to Pearson VUE, yeah, we were in touch with Pearson VUE this afternoon. We haven't had anything back from them to say that their centres are under threat of closure. Martin, I'll maybe go into a bit. Well, Martin, I will hand it to you. I've done enough talking of what would happen if a Pearson VUE centre closes in one area.
I think it's one of those situations that's very difficult as you move further towards the actual examination sitting, because Pearson VUE have an awful lot of juggling to do with seeking capacity in other test centres. And whilst we would normally do as much as we possibly can to fulfil our commitment to deliver the Section 1 examination to candidates, this is a crazy time and candidates may just need to withdraw and defer to a future examination in the event that a test centre is closed at short notice.
Good. Thanks very much, Martin. John, there's been a couple of questions about Max Fax surgery, about what's happening with their exams.
Yeah, well, we made a very early decision back in the spring. What we've got to look at is numbers. Now, Max Fax had a Section 2 exam just immediately prior to lockdown. It was a week or so before the colleges announced the suspension of all exam activity. We only had one candidate at that stage that we knew of eligible to sit Section 2, and there wasn't going to be a Section 1 before the next series of exams because of the suspension of all exam activity. Now, you cannot run an exam for 1, 2, 3, 4, 5 candidates, and you know that well, Mike. I mean, there's a number of reasons for that. You can't gather 12 examiners together, a minimum of 12 examiners for small numbers. But more importantly, you can't run your psychometrics. And we are mandated to report the reliability statistics of all examinations to the regulator, the GMC. Now, you cannot do that with a short number. We made that decision early, and it was intimated out to everyone, including the trainees, back in March by the board chair. So the bottom line is Section 1 is running the next month as normal. That was the next diet after the cancelled one in the summer. And Section 2 will run in March. There's still only a tiny number of candidates registered for that. It will increase, obviously, courtesy of the Section 2, but we will run it then. But we could not have contemplated running it for all the reasons I mentioned there on this occasion.
And so I just want to reiterate, if there's any lack of clarity, that at the moment, these exams are viewed as essential for travel. Educational assessment is essential for travel. We discussed this with Chris Whitty, the Chief Medical Officer, with our weekly call with the Academy of the Royal Colleges, and he was absolutely crystal clear about that. So whether you are at the moment in Wales or Scotland or England, or for that matter, Northern Ireland, it is still viewed as essential travel. So you are able to travel, even in those areas like Wales of lockdown. So please be clear about that. It may change, we don't know. And this is the problem that we face, and that's why we put on this webinar tonight, is to update you right up till now. We will continue to keep you updated through the JCIE website in particular, but keep a look at all of the college websites, because all the details about future exams will be there. If they're not there now, they will be there soon, so just keep an eye on that. And I can promise you we will revisit all of this nearer the time with a further webinar. But I think that I want to pay tribute to ICBSE and JCIE. Whatever the outcome, John McGregor, whether we get this over the line or not, no one could have worked harder in terms of the organisation than Martin and yourselves and the team to make this happen. We're doing this absolutely for trainees, to make sure that they are not disadvantaged any further than they already have been. And I just hope that the White Heather works, and that yes, we get this exam over the line, and that Sunderland continue to beat teams and get promotion. So I think we're at 8 o'clock. It's been really good. You've answered a lot of the questions. There's been a huge number of questions, both answered and some still to be answered. I hope that all of you out there feel a little bit reassured about this. We can't guarantee anything about the Section 2 exams yet, but everything has been done to make them happen and to make sure that you are safe and secure and you're having a reliable and valid exam. So keep in touch with the websites. I want to thank all of the panelists, and in particular Martin, John, and the two Johns, and thank you, Greg and Lola, for keeping an eye on the chat lines and the Q&As. I think it's been incredibly useful. So I hope you all have a lovely evening, and thanks for listening. Bye-bye.
Thanks, Mike.